So today's topic is autoimmune autonomic ganglionopathy. So as the term says, it is an autoimmune disease. Autoimmune is what your own body will be reacting to your own sense. That is, the immunoglobulins will act on the some part of the body, so it detects this as an antigen and act against it. So here, as it says, autoimmune autonomic ganglionopathy. So autoimmune condition is against the autonomic nervous system, which specific part of ganglions. So in the ganglions, it will be attacking the acetylcholine esterase receptors. So in autonomic system, you know there is an pre-ganglionic neuron and a post-ganglionic neuron. So this acetylcholine receptors will be in both the pre-ganglion and the post-ganglionic neurons. So when this autoimmune immunoglobulins will go and attack the acetylcholine esterase receptors, it will stop the both sympathetic and parasympathetic pathway. So as a result, in sympathetic pathway, if there is an deviation in sympathetic pathway, your heart will be the first organ to get attacked. So there will be a drop in the BP. So this leads to the symptom of orthostatic hypotension. So that means when a patient stands up from a supine position, he'll be having a giddiness because of drop of a BP. So that is one of the symptom of this condition. And when it is a parasympathetic neuron is affected, then you'll be having a gastrointestinal paresis, which means that your gastric motility will be decreased. So as a result, you will be having constipation, and also even sometime vomiting will happen. So these are the two autonomic conditions where there is a sympathetic and a parasympathetic nerve involvement. And when both occurs, then there will be an anhydrosis, which means that there will be no sweating at all. So there will be a dry skin, there will be no tears, and also even your mouth will be very dry. So these are the symptoms in regard to the parasympathetic, sympathetic, and both combined together. So how to diagnose it? So diagnosis is mainly by serological testing. You can diagnose it with ganglion ACHR, that is GACHR immunoassay, which is an radio immunoassay. It's nothing better than like an ELISA test, but you will be using an radioactive immunosubstances to detect it. So this will be a screening test. So the definitive test will be an tilt table test for this one, orthostatic hypotension, and sweat testing to detect anhydrosis, and Valsalva maneuver for detecting the heart conditions. So as a whole, autoimmune autonomic ganglionopathy is autonomic nervous system involvement with autoimmune immunoglobulins acting against the acetylcholine receptors.